Autism has been in the news lately with the restructuring of the APA manual. Autism is more common than we once thought, and we're learning more ways to deal with the disorder. Many of you are going into the healthcare field and may find this information useful during your career. Today we will discuss what autism is, the symptoms, the social development, and behavioral approaches. First, we will cover what autism is. Autism is a neurodevelopmental disability that impairs an individual's ability to communicate and interact with others. The disorder is characterized in various degrees, which include autistic disorder, Rett syndrome, childhood disintegrative disorder, pervasive developmental disorder, and Asperger's syndrome. They are what make up the autistic spectrum disorder. The autistic spectrum disorder determines if a child is high or low functioning. A high-functioning individual has mild challenges, whereas a low-functioning individual is a more severe case. Autism is apparent to have roots in early brain development, and symptoms of the disorder become fairly obvious within the first 2 to 3 years of a child's life. A child with autism usually prefers to be alone, lacks verbal and nonverbal communication skills, and displays repetitive or compulsive behaviors. Autism now affects 1 in 88 children and 1 in 54 boys. It is the fastest growing developmental disability in the U.S. with a 1,148% growth rate. Next, we will review the symptoms of autism. Identifying symptoms of autism can aid in the early detection of the disorder, which can change the course of a child's life. It is important to be aware if your child is not meeting the expectations of their age when it comes to communication skills. Here are some symptoms that should raise a red flag. If a child does not babble or coo by 12 months, does not gesture such as pointing or waving by 12 months, does not say single words by 16 months, does not say 2-word phrases on their own by 24 months, or if they have any loss of any language or social skills at any age. Another symptom is of repetitive or compulsive behaviors, which can include hand flapping, rocking, jumping, and twirling. Repeating sounds or words, arranging and rearranging objects, and lining objects up in a straight line are other behaviors they exhibit. Autistic children might also be overly sensitive in sight, hearing, touch, smell, or taste. They respond to their senses differently, such as not being startled by loud noises, or they might find normal noises too loud and are painful. Some individuals also have a high pain tolerance. Some physical contact can be overstimulating or overwhelming for an autistic child. These symptoms don't necessarily mean that your child has autism, but it is still a good idea to set up an appointment for developmental screening for your child. Now we will go over the behavior and social development of autism. Since autism affects an individual's communication skills, one who suffers from the disorder usually doesn't interact much socially, and they prefer to be alone. If there is any interaction, an autistic child usually avoids any physical contact and eye contact, and they don't initiate interaction with others. Individuals that have autism find it difficult to function with people partially because they lack the programming that others have that allows the interpretation of body language, tone of voice, and facial expressions. A sarcastic comment, a smirk of amusement, or a sigh of boredom are all lost on a person with autism. Because they can't interpret these norms, it results in them being socially awkward. An autistic person might talk on and on about a subject that interests them, but not the listener. Or something that is socially unacceptable. But this doesn't mean that you're stupid. Their brains just were not wired like others without autism. Finally, we will review the diagnosis and behavior approaches for autism. There isn't a specific test that can diagnose autism, but there are specifically trained physicians and psychologists who administer autism-specific
behavioral evaluations. First, a child has to exhibit at least 6 certain behaviors to qualify for evaluations, such as lack of eye contact, failure to develop peer relationships, delay or total lack of communication, lack of social or emotional exchange, delays in social interaction, and repetitive motor mannerisms. Next step would be to start with what is known as a modified checklist of autism in toddlers, which is a list of informative questions about your child which indicate whether they should be further evaluated. Along with the modified checklist, hearing and lead exposure tests are another useful screening tool. If these screening instruments indicate the possibility of the autistic spectrum disorder, a more extensive evaluation will take place. These evaluations require a psychologist, neurologist, psychiatrist, and a speech therapist. This team will start a thorough neurological assessment and an in-depth cognitive and language testing. After several evaluations with this team, such as the Autism Diagnostic Interview, the Autism Diagnostic Observation Schedule, and the Childhood Autism Rating Scale, you will receive the diagnosis of your child. Once diagnosed, there is no cure, but plenty of behavioral approaches that can assist you and your child. There are educational and behavioral interventions, medications, and other therapies if you are interested. A therapist can come in to deliver home services that also include parent training, or there are plenty of other programs such as special ed centers, classrooms, and or preschools. These are very helpful as they teach social interaction and communication skills. Either route should offer structured therapeutic activities that focus on the core areas affected by autism. Today, we have discussed what autism is, the symptoms, the social development, and behavioral approaches. With autism affecting 1 in every 88 children, it is important to be knowledgeable of the disorder, as it can affect any family.